Ladies and gentlemen, thank you for your patience in holding. We now have your presenters in conference. Please be aware that each of your lines is in a listen-only mode. At any time during today's presentation, you may submit your questions electronically by typing them in the chat window located to the right of your slideshow. At the conclusion of the presentation, we will also take audio questions, and at that time, instructions will be given as to the procedure to follow if you would like to ask an audio question. It is now my pleasure to introduce today's first presenter, Ms. Elisa Arispacochaga.
Thank you, David, and welcome this afternoon to the Physician Leadership Forum's webinar on preventing physician burnout, what hospital leaders can do to make a difference. To present today's session, I'm really pleased to have with us two fabulous speakers, Dr. Paul Deschamps, who is with Simpler, an IBM Watson Health company, and Dr. Diane Shannon. And they'll be discussing physician burnout and what healthcare leaders can do to really reduce the drivers of burnout and return joy to patient care. Now, their bios are in the materials, and we'll be posting these on our website after the program. But I'm really pleased to have them available to do this. With that, I don't want to take any more time, and I'm happy to turn this over to Dr. Shannon to take you through the beginning of the presentation. Dr. Shannon, the floor is yours.
Thank you. Good afternoon, everyone. I want to start by asking the question, why is burnout a topic worth our time and attention? Physicians are in crisis. Evidence suggests that only about 10% of physicians would recommend medicine as a career. More than half of physicians surveyed have at least one feature of burnout. And almost a third of young primary care physicians say they're going to leave practice within 5 years. This suggests we have a problem. So why is a crisis among physicians important? This is data from Kate Shanafeld and other researchers at the Mayo Clinic. Population, physicians have significantly higher prevalence of burnout. And not only that, but when the researchers looked at data from 2011 and compared it to 2014, there was a significant increase in physician burnout, while that of the average U.S. worker remained steady. And what this says is that about half of physicians are experiencing burnout. If we have 850 physicians in the country, that means that right now, somewhere around 450,000 physicians are experiencing burnout. Now, why is that important? If over half of your medical staff are not performing to their top potential, it hurts an organization's ability to perform on quality, service, cost, and growth metrics. Now, Shanafelt and researchers also looked at another measure, which was satisfaction with work-life balance. What they found is that while the average U.S. worker was more satisfied with work-life balance, physicians had a decrease in their satisfaction with work-life balance from 49 to 41%. Now, what does this mean? Well, what would a physician do if they're experiencing a decrease in their work-life balance or dissatisfaction with it? They respond by reducing their workload, by reducing their work hours. So if you have a primary care physician who generates $1.5 million a year in revenue for the hospital, a 20% drop in FTE going from 5 days to 4 days a week would translate into a $300,000 reduction in hospital revenue. So this is an important issue for CFOs and other leaders to pay attention to. What are some of the consequences of burnout? Well, first, there are patient care consequences. Burnout has been shown to be associated with an increased likelihood of medical error, suboptimal care practices, and unprofessional conduct. Not only this, but there are other costs. In addition to the effects on the hospital revenue, replacing a physician is expensive. It has been estimated that if a physician leaves and needs to be replaced, the cost of that recruitment and replacement is somewhere between $250,000 and $500,000. So that can add up really quickly. In addition, there's a human toll. Burnout is associated with alcohol abuse and dependence and with suicide ideation. Now, I was not aware of this until just a few years ago, but the risk of suicide among physicians is much higher than that of the general population. In fact, among female physicians, it's 130% higher than females in the general population. For males, it's 40% higher. Now, that translates into somewhere around 300 to 400 physicians dying every year by suicide. That is the equivalent of 2 graduating classes from medical school. And suicide is just the tip of the iceberg in terms of physician suffering. Now, you might ask, are there certain fields that are more prone to experiencing burnout? There is some suggestion that emergency medicine and primary care specialties are especially hard hit by burnout. But if you look at these numbers, and this is data from 2016, you can see that even at the lower range, we're talking more than 1/3 of physicians reporting burnout. And data from just a year later in 2017 shows even worse statistics. Why? Why is the prevalence of burnout among physicians getting worse? Dr. Deshant and I recently finished a book published in December on preventing physician burnout. We spent about 18 months interviewing physicians and experts in burnout and health system leaders. And as part of that, we developed an idea, a model, that looks at 3 levels of drivers of burnout. The first level has to do with the individual physician. So those are stressors that an individual brings with them to work every day. Now, for a physician, that includes high educational debt. For many physicians today who are leaving training, they're coming out with debt somewhere in the $300,000 range. That is a lot of stress to carry. There's also the inherent stress of practicing medicine and the acculturation within medicine that says you cannot have any weakness. The next level is the workplace. Now, these are factors that are present in the immediate work environment of the physician, frustrations and barriers to care. These can create a toxic workplace environment. The third level is the external drivers. Now, those are factors that are outside of the hospital or health system or physician practice that put pressure on that organization, which is then transmitted to the physician. What are some of these factors? The EHR, meaningful use requirements, the CMS with its increased regulations and the regulatory burdens related to ACA and MACRA, star ratings for hospitals, payers who sometimes will use the EHR to then deny payment, ICD-10 and its applications, Press-Ganey surveys, patient demographics changing, including an increase in chronic disease and changing patient expectations, leading to physician or patients coming to their physicians with information that they've obtained from the internet, some of which is great and some of which is not so great. And Yelp and other ways that patients can review physicians online, also increased restrictions or regulations related to maintenance of certification requirements. And finally, reduced reimbursement so that physicians are paid less per unit of service. These external factors are what have changed over recent years. And these are what are leaving many physicians feeling that this is what their career is like. Being trapped in red tape and clerical duties and other forms of non-direct patient care, when that's not what they entered the profession to do. For me, I left practice because of burnout many years ago. This was before the EHR, before MACRA, before ACA, and some of these other external factors. For me, when I look back now, I can say that the reasons that I left had more to do with this, with the chaos and the disorder. This was in the days before the IOM to Ares Human Report, and there was much less understanding about the importance of patient safety and what could be done to reduce the risk of harm to patients. For me, I carried around that sense that my patients might fall through the cracks, and it felt like I was working on a rickety bridge over a torrent of water. I found myself feeling hypervigilant, worrying about my patients even when at home, and over the years that took a toll during training and the brief time that I practiced. It felt too often that I was living in the red zone. And what I can say now is that I was reacting to a toxic workplace, one that had not yet acknowledged the importance of patient safety. Today, that's very different, and there is an acknowledgement of the importance of patient safety, but there are other new stressors that are causing burnout among physicians. Now, I was very lucky in that I landed on my feet. I took a position at a communications company. I began writing and eventually left to pursue a freelance writing career, which has been wonderful, and at the same time, I miss patient care. And I consider it a tragedy when a physician needs to leave. Now, in 2013, I told my story publicly about burnout and leaving medicine, and physicians began contacting me privately to tell me their stories. They would never tell these stories out in the public because of the concern about their reputations and their future career. But they have heartbreaking stories of individuals who are dedicated professionals who want to remain in patient care but feel that the situation is simply unsustainable. Their stories are what motivate me to continue talking about ways to prevent burnout. And I've learned a great deal about burnout in the past couple of years. When I experienced it and when I left, I actually had no idea that that's what it was that had caused me to leave. It was only in recent years that I read a definition of burnout and understood that that is what had caused me to leave practice. Professional burnout has three manifestations. Exhaustion, generally or originally described as emotional exhaustion, but now expanded to include physical and cognitive exhaustion as well. Depersonalization or cynicism. So that's a distancing of oneself from the emotional aspects of work, from the organization, its purpose, from patients, perhaps beginning to see patients as yet another admission or a number or a case. And the third manifestation is a loss of sense of self-efficacy. It's a low sense of personal accomplishment in one's work, feeling that one's work doesn't make a difference. Now, research suggests that cynicism is a manifestation that has the highest risk of progressing on to serious consequences. And I want to say that burnout is not a clinical diagnosis. That's important to know. It is also not just needing a vacation. It is not depression, and it is not just feeling tired. It is actually a natural human response to extreme stress in the workplace. Research from Christina Maslach, Michael Leiter, and Mark Linder has identified some of the drivers in the workplace that are predictive of burnout. The first is work overload. For physicians, that's often time pressure related to productivity pressure in many cases, chaotic work environment. Now, this is something that I experienced. Second is the loss of control over their schedules, sometimes over decisions about patient care. Insufficient reward, that includes financial, but also the non-financial rewards, recognition, respect.